Okay. All right, on behalf of the Epilepsy Foundation of Wisconsin, I want to welcome you all to this week's virtual meetup. This week we are going to be talking about VNS, so vagus nerve stimulation, with Jim Chase. I will have him introduce himself in just a minute. I just want to go over a couple things before we get started. So we are going to be recording this evening so people can look back on it. So there's no need to take notes or anything. It will be up on our website probably early next week, I would say. So our website is epilepsywisconsin.org. And then kind of how tonight will work is if you have any questions, there is a Q&A button at the bottom of your screen. So if you click that, you can type your questions in there, and then I will do my best to relay them to Jim. Not all questions will be able to be answered just for sake of time. There is an email, though, that you can submit questions to if they don't get answered or if you think of something after the fact, and that is connect@epilepsywisconsin.org. So connect@epilepsywisconsin.org. Everybody on this call is muted and your video is off. So again, please use that Q&A button if you have any questions. I think that is all as far as the process goes. So my name is Alicia Thompson. I am the program manager for the Epilepsy Foundation of Wisconsin, and I am based in Eau Claire. I have been with the foundation for almost a year now, which is hard to believe. It seems like it just flew by. And then I've been in the nonprofit human service area for about 7 years. So really excited for you guys to be joining us tonight, and I will turn it over to Jim.
Thanks, Alicia. As Alicia mentioned, I'm Jim Chase. I'm the therapeutic consultant for LivaNova. I've been with the company for 2 years, and I cover the western part of Wisconsin, so the Eau Claire and La Crosse areas, as well as the state of Minnesota. So there are 2 other colleagues of mine that do cover the rest of Wisconsin, so there certainly is coverage for that. And the majority of my job is spent talking with patients just about VNS therapy and as an option for those patients. Overall, it's a very different mode of therapy than the drugs that are on the market. We are indicated for patients that have failed 2 or more medications. So this is refractory patients that we're indicated for specifically. Any patient that's over the age of 4 that is refractory, as I mentioned, that has a partial onset seizure is what we are indicated for in terms of our overall general indication of VNS therapy and who can utilize the services. So again, these are patients usually that have tried at least 2, but most have tried many more than 2 medications and have not had success in reduction of seizures and are looking for some other options out there. And VNS, it doesn't work like the drugs. It's a small implant that wraps around your vagus nerve and gently stimulates there, which can basically, the stimulation will basically alter the EEGs in the brain and can potentially reduce the seizures onsets, could actually shorten seizures as well. So just to give you an idea, just a brief overview, this is our newest device on the market. It's called the Sentiva. It's kind of odd to do this on a Zoom, as you can imagine, but to give you some scope, this is a quarter. So the size it's a little bit bigger than a quarter to give you an overall feel. And then the soft lead that wraps around the vagus nerve is this. So a very, very small piece of material. So it's not brain surgery. It just wraps around the vagus nerve in your neck. The procedure itself is an outpatient procedure. So it's done in the hospital, but most patients go home that same day and are back to normal work within a couple days from the procedure itself. In terms of potential risks with the surgery, it's very mild. So potentially, obviously, some bleeding at the incision sites, or potentially infection at that site. Very, very low chance of those. It's actually less risk than getting your tonsils taken out, just to give people some perspective. Most people are pretty comfortable with what that might look like in terms of getting your tonsils taken. Not a high risk in terms of the procedure itself. So the way that VNS works, it's got 3 different modes of therapy. So you've got a normal mode that think of as just sort of an on and off, where it runs 24 hours a day, 7 days a week. Most patients don't even realize it's running. It's just in the background, lightly stimulating the vagus nerve. And most of the time it's running, it's 30 seconds on, for example, and 5 minutes off. That's a pretty common setting. All times it's just running in the background, 30 seconds, and then takes a 5-minute break. Another way that the device works is there's a set of magnets that each patient has. And what you can do is actually swipe the magnet over the device if you feel an aura, or if you believe that a seizure is coming on, or if a caregiver sees a seizure actually happening, they can also swipe that magnet. And that'll also provide stimulation on demand right at that time to actually hopefully stop the seizure, or at least hopefully the period after the seizure is over. And then the final way that the device overall works is it's a smart device. So the Sentiva is actually monitoring your heart rate at all times. That's set up actually in the operating room. And what it's looking for is a jump or an increase in your heart rate, a really rapid one, not where you would just start working out, but where if you were to do something very aggressive, like where you jump up and down very quickly, then the device would actually fire. It's called our auto stim. So it's stimulating. It's looking at that as a potential indicator that there's a seizure that's about to happen. And so it will fire at that time to hopefully stop a seizure at that point in time. So in terms of after the device is implanted, and side effect profile, I know most patients are always curious about that as well. Most patients, if they have a side effect at all, it's going to be sort of a tingling in the throat itself, some feeling of difficulty swallowing, a slight shortness of breath, and hoarseness in their voice. And all of those are only experienced when the device is actually activated. It's not necessarily at all times. Most people, if they experience those at all, those do go away over time. They become accustomed to the feeling, and basically the nerve gets used to the overall feeling of the device. So Alicia, do you want me to talk a little bit about also the titration period, or the period of ramping up the device? As I mentioned, if there is some of that tingling feeling, that's going to be usually in the very beginning. So what is done is 2 weeks after the surgery, the patient, you would go back to your neurologist, and they would use a device that would look very similar to this. It's a little wand, and it's just placed right over the generator, just over the skin. You can go through the shirt, without a problem. And then they have a tablet that looks just like this. And at that point in time, they'll turn it on to a very low setting that most patients, again, don't even feel. And we'll then set up a schedule where the device will very slowly, over the course of a 7-week period, ramp up the amount of stimulation. There would be, at that point in time, we would go back to the neurologist and then do that one more time for a second dosing. So where it would actually dose up over a 14-week period. So it does take some time for the device to actually get to full efficacy. 14 weeks would be when it actually is fully turned on for most patients, and that varies patient to patient. And we'll work with your neurologist specifically on how your therapy should be catered specifically for you. But typically it takes some time. And then most patients aren't seeing all of their results until at least 1 year out. There's not really, as opposed to some of the drugs on the market, there's not a honeymoon period with this. It's the reverse effect, whereas with some of the drugs that might work right away, but then their efficacy stops working or decreases over time. This device over time will continue to have better and better results for patients when it does work. So at 1 year would be better than, for sure, the first few months. 5 years better than the first year and a half, 2 years, and then beyond that, continue to have better efficacy over time. So I think that kind of covers a brief overview of VNS. I know Alicia had a couple extra questions for me. So
yeah, so going back to what you were just talking about before, about the turning up process. So if somebody, let's just say it's 4 months after they've gotten the surgery, okay, and they are, they feel that it's not working. So I think it's important that you talked about that, because like you said, a year is kind of when, do you know what I'm saying? You can't really judge it off of that short of a period of time. Am I understanding that correctly?
Correct. Yep. Yeah. So when a patient first has the device is first turned on, it's not even close to what would be considered a therapeutic level, where the device is actually providing enough therapy. Think of the nerve as sort of like a spaghetti noodle, and the lead actually wraps around that nerve, and you're trying to get enough stimulation to actually get all of the nerve setting. It's only getting the very outer edge of that nerve. It needs to be turned up a little bit more, within tolerance for the patient, of course, but a little bit more to actually have the nerve get have the full effect of the actual stimulation to go through the entire nerve and make sure it's stimulating all the follicles of that nerve.
Okay, that's very interesting. Wow. So you talked about surgery process. Sounds fairly, I guess if you explain it to somebody, it's not scary. And you said the risks aren't very high. But overall, when the surgery is done and everything's healed up, I mean, is there any risks in general to have a VNS?
You broke up at the very end.
Oh,
overall,
sorry.
Is there any risk with what? I'm sorry.
Is there any risk just in general to have a VNS? Is there any side effects, I guess?
No, so just the side effects that I mentioned that in the beginning. So again, this isn't invasive in your brain surgery. This is just a nerve stimulator that's wrapped on the left side of your neck. So the only thing that patients experience is when the device is actually on would be that tingling, some difficulty potentially swallowing, shortness of breath potentially, and then hoarseness in their voice. And the hoarseness is probably what's most noticeable for people.
Okay, that makes sense. Thank you.
Mm-hmm.
I don't think you covered this, but how old do you have to be? I can't remember if you covered that in the beginning. Is there an age limit?
Yeah, so 4 years of age or older is what we're indicated for.
Okay.
So so pediatric patients for sure is about 25% of the patients that actually have VNS implanted are pediatric in age.
Okay. We do have a question that came in. Let me see. It is, so why the left side and not the right side?
It's a great question. Yep. So so there's two vagus nerves. The left side, the majority of the majority of the nerve fibers run to the brain, versus the right side where it's actually 50-50. So we want to make sure that we're on that left side. That's the main reason. Another secondary point is that the right side vagus nerve actually has a lot to do with the heart and the timing of rhythm management. So we are indicated for left side. There are rare instances where right side happens, but it's definitely a left side indication. Hopefully that answers the question.
Yep, let me see if we have any. Okay. How long does the battery last? I guess in general, does it depend on how many times it's, pumping? I guess if you could elaborate on that a little bit, if someone's battery could last longer than somebody else's battery.
Yeah, and absolutely, and it does. Ultimately, when these devices are implanted, neurologists are obviously treating the epilepsy and the seizures and trying to control that, and overall, hopefully improving quality of life. And that's the goal, particularly, in these situations, is to try to improve that quality of life. So it really depends on how much. As I mentioned in the beginning, there's that 5 minutes off and 30 seconds on. Each neurologist is going to cater to each patient differently based on how they want to hopefully attack those seizures. And so it could be on for more time than less of a break and for more time than that 30 seconds. And that would shorten the overall battery life. But generally speaking, the range has been anywhere from 3 to 12 years. So it's a very, how the device is set up for that patient.
That's a really long time. I wasn't expecting that long. That's cool.
Yeah.
We talked before we started this, you and I were talking about, so going back to that turning up process, I believe you said something about it can be done remotely. Did I hear you correctly? They don't
Correct.
have to go, okay. Can you talk about that a little bit?
Yeah, absolutely. So with the newest device, the Sentiva that's recently been added on the market, it's a smart device. So it monitors that heart rate, but not only does it have that, it has a scheduled programming where your neurologist can, the first time they come in, you do have to go in initially, they would turn on the device, but they can create a schedule where the device will go up every week or every 2 weeks automatically at a given time that you would discuss with your neurologist about what time that would be at to make it the most appropriate for you, so that you would know if you're having some issues with it, you could at least get to the office. But it would do that a gentle and gradual increase on its own over the course of.
Okay, let me see. We have a couple questions. Sorry, I'm just reading them.
I'm sorry.
One of the questions is, and I think you kind of touched on this, but so the question is, what's the point of it monitoring your heart rate? How is that related to seizures? But I think you kind of touched on that, but if you.
Yeah, but no, great. I didn't, thank you for asking that question. I appreciate it. So there have been several studies that have indicated that there's a sharp increase in heart rate just before seizures onset. So it's been done in EMUs. They've done several studies on that. So the company, LivaNova, wanted to have a device that was stimulating based on that specifically. It doesn't mean for sure that there is a seizure with that. I mean, it could be something else that's caused an increase in heart rate, but a lot of times it is. And so it's a mild stimulation. Again, most patients don't feel it. There's no real risk to have it go off. So the thought process is to have the device monitor that heart rate and hopefully stave off seizures. So hopefully that answers your question.
Okay, thank you. Another question is, what type of success has this device seen over the years?
Over the years, well, so I think the best, it's a lot of success for sure. Overall, I think one of the best and most telling components to the device itself is just our patients, and the patients that when their battery does get old and needs replacement, that 85% of our patients, for one reason or another, decide to get a new battery. So it's doing something for them, whether it's a quality of life that they're seeing an improvement in, whether it's a reduction in medication or a reduction overall in seizures. There are lots of different benefits of it, which all definitely should be discussed with a neurologist. But that I think that the 85% of patients that have the device getting a new battery is pretty telling.
Great.
Yeah, and if they want me to elaborate on anything else specifically, please go ahead and ask.
Let me see. You covered a lot of the questions that I had. So let me see what we have. Here's another one. The question is, can the lead ever be taken off of the nerve? Would there ever be a reason to take it off?
The lead, I think it's
the lead. Yeah, sorry.
Yeah.
I heard it.
Yep, it's quite all right. Yeah, it can be taken off the nerve. It's not necessary. The only reason that would ever happen is if something had damaged the lead, so some type of trauma, car accident, something like that. But would still not be necessary unless there was the trauma and then wanting to have a VNS be effective again. So with these battery replacements, 90+% of the time, patients, the lead is perfectly intact. It's literally just replacing the battery that sits in the left chest, just below the skin. So it's even a shorter procedure than the first implant.
Okay. There's a question, are people often able to stop their traditional meds after the device is turned off?
Are they after the device is turned off?
Turned on, I'm sorry. Turned on.
Yeah, no. So it's an adjunctive therapy. So it's designed to be used with anti-epileptic medications. So most patients do not stop all of their medication altogether. They have some medication still. With that said, a lot of patients certainly have a goal that they work with their neurologist to at least reduce the amount of a medication or the number of different medications that they have.
Okay, great. There's another question. What % of people does it help reduce seizures? I know you and I touched on this. Do you happen to know a percentage for that?
The reduction in seizures?
Yep.
Yeah, so about 60% of patients have over a greater than 50% or greater reduction in seizures, if that makes sense. So if you were to have, for example, 8 a month, at least six out of 10 patients would have that reduced to at least 4 a month. So pretty impactful. Especially when you consider post-ictal period and recovery time from a seizure from one to the next.
Yeah, definitely. Another question, what types of activities does a person have to stop once they have their VNS, if there's any? Can people still swim? Can they still be very physically active?
Yes, absolutely. Can be completely normal activity. Most doctors would probably say wait a week or two before lifting strenuously, like a bench press or something like that, just to let that the chest fully heal. But every activity that's currently done certainly could be done with VNS moving forward.
Okay, wonderful. Jim, I'm just going to give everybody, another minute or so to see if any other questions come in. That's the last one that I see here. Mm-hmm. Is there anything, I guess while we wait, is there anything that we didn't cover that you want to talk about?
No, I think we've covered, most everything. Just a basic overview of the procedure, the device itself. We are here. One other thing to say is, whether it's myself or one of my colleagues, we are here to be an asset. I realize surgery is always a scary thought process, and don't take that lightly at all. So we're here as an asset to answer any questions you want. At different times, we certainly meet with potential people that are considering this procedure and go over the device. It obviously can't be done right now at this particular time, but I'm assuming we'll get back to some level of normal and be able to do that again in the near future. And then, we have nurses that work alongside us as well that can answer questions from that perspective. If you're more comfortable talking specifically directly with a nurse that have done it for years and talked with several patients about this. And we also can connect you with patient advocates that have actually had VNS and can really truly speak to VNS and what it's done for their lives. So, I always recommend that to anybody that's considering this to talk to some patients that actually have VNS.
Wonderful. There's a couple more questions. If you already have a VNS, can you get an updated model later on?
Yes. Short answer is yes. You definitely can.
Okay.
So, yeah.
I have a comment from Sue. She said this is the best treatment that her son has ever received. So that's wonderful.
Glad to hear that, Sue.
Thank you for sharing that.
Yeah, thank you.
And Jim, that looks like it's all in the Q&A. Again, if there's something that I missed or you have questions later on, feel free to reach out to us at that connect email, connect@epilepsywisconsin.org. Thank you everybody so much for attending. Jim, thank you for your time. Really appreciate it and all your knowledge. Very, very thankful. We will, like I said, we'll have this recording up on Facebook and our website early next week, so you can take a look at that. With that being said, Jim, thanks again, and I hope everybody has a good night.
Yeah. And we're I'm here if any questions come up, and Alicia, I'm sure you can filter those through to me. I'm happy to answer any other questions that come up over time. So.
Absolutely. All right. Thanks, Jim. Appreciate it.
Thank you. Yeah. Have a great night.
Bye.